Hi, I'm Dr. Wendy, aka DrEverywoman, and I am back. And you know what we're doing? Taking off the white coat. All right, I've taken off the white coat, and today I want to talk about LEEPs. So a LEEP is a procedure that is done if you have advanced precancer on your cervix. So let's back it up real quick. Quick summary, okay? Cells on the cervix, when you get a PAP, can show levels of abnormality. And some levels are closer to normal and some levels are closer to cancer. Our bodies are typically able to regenerate and fix mild cellular changes that have occurred that can be abnormal. They can fix it. The body can fix it. It can go back to normal. But in some circumstances, there's either aggressive HPV present, human papillomavirus, get your Gardasil, get your HPV vaccine. There's either aggressive HPV present or just the cells are really abnormal. And so that can progress onto cancer. But remember what I told you in the colposcopy video, you will not get cervical cancer if you follow up. You will not get cervical cancer if you get your PAP and you follow up. So if we get a colposcopy and it shows cellular change, things are looking not so great, hey, it's time to take off a portion of that cervix before it becomes cancer. That's how we prevent cervical cancer, is we stop it before it becomes cancer. So if your colposcopy has shown that you have high-grade cells, moderate or high-grade is all considered high-grade, that's more likely to progress onto cancer in time. And by the way, in time usually is years, not like weeks or months. So if your LEEP is scheduled for a couple months after your colposcopy, you will live. So LEEP, though, is a procedure. It stands for Loop Electrosurgical Excision Procedure. It is a electrically charged loop that looks like a little cheese grater. That's terrible, but that's what it looks like. And it scoops off a portion of the cervix. Now, mind you, the cervix is about 4 to 5 centimeters long. The uterus is about the size of a person's fist. The cervix within that is about 4 to 5 centimeters long. The LEEP is usually going to take off the last little half of a centimeter. It's not a lot. It's not enough to disrupt the uterus. It's not enough to typically cause any problems with pregnancy later, but it is enough to stop you from getting cervical cancer. You don't want cervical cancer, right? Nobody does. That is not the cancer you want. You don't want any cancer, but you really don't want cervical cancer. So get your LEEP if you need a LEEP. The LEEP is going to remove a portion of that cervix. The cervix will heal. The body will regenerate to a degree, and you'll be okay. And then you follow up with PAPs usually every 6 months for a while, and then up to a year after that. But that's what a LEEP is. I do mine under local anesthesia. So just like if you had a dental procedure done and you needed lidocaine, that numbing medication injected into your mouth, I will do that same procedure within the cervix. So I numb the cervix, and then I make sure the person is numb, make sure everything, and I know exactly where I'm going because I've looked back at my colposcopy diagram. I know where I'm going to be, and then I remove that portion, and then I typically will ablate the base. So meaning I take the heat delivering device, and I burn the base of what I took off, the kind of crater of what I took off of the cervix. That way, if there were any microscopic cells that were left behind that could be problematic, I have destroyed those cells. So I'm kind of like, it's almost like you pull up weeds and then you spray some weed be gone. That makes your none grow back. Like that's what I'm doing at the end of a LEEP. And then I have people follow up in a couple of weeks, make sure everything's healing okay, and then 6 months to do another PAP. So I hope that helps. That's LEEP. Go back and check out the colposcopy video. Go back and check out the PAP video. I've talked about why PAPs are 3 to 5 years. I talked about what you do if you have an abnormal PAP. And drop any questions in the comments. I didn't say that in the other videos, but drop any questions or any other topics you want me to cover, because I'm going to be doing this more often now that I have somebody to edit my videos. I'm excited to share all that I know because I remember not knowing this stuff. So I want you to know what I didn't know and what I know now and what I share with my patients day to day. So thank you for sticking around. Like, subscribe, tell a friend, and as always, visit your local friendly gynecologist.